Fabry disease is an ultra-rare genetic disorder in which there is a deficiency of the lysosomal enzyme alpha-glycosidase A. This enzyme is responsible for breaking down sphingolipids, a fat-like substance, and works to prevent them from accumulating in blood vessels and tissues. Fabry disease is neither dominant nor recessive and is involved with the GLA gene. Fabry disease can be hard to live with due to the fact that it affects the whole body and causes chronic and intense episodes of pain. These episodes occur in the hands and feet. Other common things that happen are red spotted skin rashes, a progressive loss of vision and hearing, and problems with kidney function. Fabry disease also makes individuals with it live in constant fear as they have a higher risk of life-threatening heart attacks and strokes. While it is not notably visible when someone has Fabry disease, it is still very serious. For males, Fabry disease can be diagnosed with a blood test. This blood test will test for low enzyme activity in the enzyme alpha-GLA. If the enzyme has a low enzyme activity, then the person has Fabry disease. For females, it's a bit different because there is a required DNA test, due to the fact that alpha-GLA enzyme levels in blood may be low or near normal in females, making it harder to give a proper diagnosis. The DNA test allows for a clear-cut answer with no interruptions if the person has Fabry disease or not. The approximate average of people who have Fabry disease is 1 in 15,000 worldwide.
First of the names for the condition are Anderson-Fabry disease, and alpha-galactosidase deficiency. Another interesting fact is that there are two kinds of Fabry diseases. Classic type, the symptoms appear during the childhood or teenage years, or late onset when people don't have symptoms until they're in their late 30s or older. With late onset, the symptoms that show it tend to be more harsh, such as kidney failure or heart disease. Classic types start off with burning sensations in the hands and feet. Another interesting fact is that there are 50 other diseases that cause an abnormality in lysosomal function. Also, Fabry disease can lead to different colored eyes. They tend to be gray eyes, brown or yellowish streaks appear on the carina. An interesting statistic is that Fabry disease is found in roughly 1 in every 40,000 males and 1 in every 20,000 females.
Fabry disease affects males and females of all racial and ethnic.
Fabry disease is not something you can catch like a common cold. It is passed down in your family through DNA. Fabry disease is a X-linked condition that specifically affects the GLA gene. It is neither dominant or recessive due to the fact that it is a mutation.
Fabry disease has many symptoms, including numbness, tingling, burning or pain in the hands or feet, extreme pain during physical activity, heat or cold intolerance, abnormal patterns in the eye, dizziness, hearing loss, ringing in ears, high levels of protein in urine, raised darkened skin lesions on the back and chest, sweating less or not at all, and swelling in the legs, feet, or ankles. Flu-like symptoms including fatigue, fever, body aches, diarrhea, constipation, abdominal pain.
Luckily, Fabry disease is not deadly. If you have Fabry disease, it does not mean that you're going to die at a super young age or a painful death. However, it does decrease the life expectancy of a males with Fabry disease tend to live an average about 58 years compared to the 75 years for men and the general population. For women, their life expectancy with Fabry disease tends to be around 75 years old compared to 80 years old most women in the U.S. generally have.
Fabry disease is incurable due to the fact that it is a genetic disorder. However, there are many treatment options to help ease the pain of people who live with Fabry disease. Some treatment options include simple medications for pain and stomach problems. With this, there are two main Fabry disease treatments that slow down the buildup of fatty substances to help the goal of preventing heart problems, kidney disease, and life-threatening complications. One is enzyme replacement therapy. Every 2 weeks, a person with Fabry disease will receive an intravenous infusion of a lab-made enzyme that is very similar to alpha-GLA enzyme that the body is lacking. The average annual cost of enzyme replacement therapy is between $4,951 and $69,176 per patient. Treatment option 2 is oral chaperone therapy. Oral chaperone therapy are very small molecules that repair defected alpha-GLA enzyme. For this therapy, you take a pill every day to stabilize the defected alpha-GLA enzymes. This medication unfortunately does not work for everyone. It depends on your specific genetic mutation and the GLA gene.
One very good place to donate is the National Fabry Disease Foundation. This foundation works tirelessly to find new treatments for Fabry disease, as well as understanding more about the disease itself. Since this disease is pretty rare, it is important to support foundations like this to learn more about Fabry disease.